Hi everyone, it's Dr. Custer here. Today we're going to do a lecture on p-value in the null, confidence intervals, power, and errors. I call this a basic review. So the normal disclaimers. I am not a statistician. I have a slight understanding of statistics and am just relaying the information to you. This video is for educational use only and is not intended to be sold. I love to work with others, so please contact me at the email listed for collaboration on any projects, and I have no disclosures. So the goals of the lecture, what are we going to review today? The null and alternate hypotheses, p-value and statistical significance, standard error of the mean, confidence intervals, incorrect conclusions, and power. Now I know you guys are probably wary of this lecture, but I think it'll be good for you to understand all of these concepts so you can understand what you're reading in the literature. So let's talk about hypotheses. A lot of you know this. This will be a basic review. The null hypotheses. So hypotheses is the null is clear expression. It is essential to establish the null hypothesis before you conduct your study. So the null hypothesis typically states that there is no association between the exposure and the outcome. And the alternate to that is, of course, the alternative hypotheses, that it states that the exposure is in some way related to the outcome. So, for example, if you were studying the effect of a blood pressure medication on a patient's diastolic blood pressure, your null hypothesis would be that there is no association between the medication and the diastolic blood pressure. The alternate would be that the medication either reduces blood pressure, so that would be a one-way hypothesis, or you could say that it has some effect on blood pressure, which is a two-way. So we talk about this idea of p-value all the time. The p-value represents the probability that the null hypothesis is true. So basically, it's the probability that your results are due to chance and not by the intended exposure outcome. For example, a p of 0.01 means that there's a 1% probability that there is no association between the exposure and outcome. And for example, this would be like aspirin and the risk of MI. So this means that there's such a small probability, and we'll talk about the accepted alpha level of 0.05. There's such a small probability that the intended effect was due to chance that it is accepted and proven to be statistically significant. So that's all that means. To determine whether to reject or fail to reject the hypothesis, we compare the p-value to the preset alpha level, and this is what we were just talking about. So most investigators believe a p-value of less than 0.05 is an acceptable threshold. So all that's saying is that there's less than a 5% probability that the null hypothesis holds true, and that although you reject the null and accepted the alternative. So here's a question to kind of put this into some context. A study is conducted to evaluate the association between serum homocysteine level and the risk of MI. The study concluded that a high baseline plasma level is associated with an increased risk of MI with a relative risk of 1.08 and a p-value of 0.03. Which statement is most accurate about the results? So here's the choices. There's an 8% chance the increased homocysteine levels cause MI. There's a 3% probability that there is no association between MI and serum homocysteine level. The 95% confidence interval for the relative risk includes 1.0. The study has insufficient power to reach a definite conclusion, or there is a 10% probability that the association is underestimated. And like we talked about, p of 0.03 represents 3% probability, right? So the answer is choice 2. All right, one more question. Highest plasma CRP level is believed to be associated with increased risk of acute coronary syndrome. A group of investigators is planning a study that would evaluate that association, taking into account a set of potential confounders. Which of the following is the best statement for the null hypothesis for this study? And so we look at these choices. So high plasma CRP carries an increased risk of ACS. High plasma CRP is related to the occurrence of ACS. High plasma CRP has no association with ACS. ACS can be predicted by high plasma CRP, and then high plasma CRP level can cause ACS. So when we're looking for the null hypothesis, as we've said, that would be no association. So that's the correct answer. So briefly, let's go back over standard deviation. Standard deviation and variance relate to the average amount of dispersion or variability about the mean. And here we see the normal distribution curve with the mean at the 50th percentile. You remember the 68, 95, 99 rule, which states that 68% of the data will lie within one standard deviation of the mean, 95% within 2 standard deviations of the mean, and 99% within 3 standard deviations, of course, if the data is normally distributed. And then the last thing to keep in mind is the 95th percentile is 1.96 standard deviations, and the 99th is 2.575 standard deviation. And here's the formula for standard deviation. All right, enough review. But what about standard error of the mean? So this shows how precisely the study sample represents the general population. It's always smaller than standard deviation because it's calculated as the standard deviation divided by the square root of the sample size. So here we go. Now note that n is inversely related to the standard error, so as the number of data point sets and the increases, the standard error of the mean decreases. And so let's look at confidence intervals and how the standard error of the mean plays into that. Confidence intervals provide a range of values which is likely to contain the population parameter of interest. So a 95% confidence interval is just basically the interval of values within which we can be 95% confident that the true parameter lies in, after accounting for random error. And for example, if the relative risk of something is 2.0 and the 95% CI is 1.5 to 2.5, we are 95% confident that the true relative risk lies between 1.5 and 2.5. So let's talk about this. The formula for confidence interval, as you'll see here, is the mean plus or minus the z-score times the standard deviation divided by the square root of n, your sample number. And so we look at our confidence interval. Remember from what we said before, 95% confidence level is 1.960 z-score, standard deviations from the mean. So here we would, if you were looking for your 95%, then it would be the mean plus or minus 1.96. So anyway, my point is, here's the calculation relating to standard deviation and standard error, and the confidence interval varies directly with standard deviation and inversely with the sample number. So as your number goes up, the confidence interval will narrow, and as your sample number decreases, your confidence interval will increase. It will widen. So for confidence intervals, a few things to know. A value of 1 for a confidence interval indicates that there is no association between exposure and outcome. And that makes sense. If something reduces the risk, it would be less than 1. It would be any number below 1. And if it increased the risk, it would be above 1. But what happens at 1.0? That just means that there's 0 risk. There's no risk at 1. So that means that the result is not significant. So if the relative risk is 1.5, but the confidence interval was 0.8 to 1.9, then it's not significant because it crosses 1. So the width of this confidence interval is inversely related to sample size, like I just said on the last slide. A larger sample size has more precise results, which would result in a narrower confidence interval, whereas a wider confidence interval would result with a smaller sample size and would be less precise results. So here's a clinical question. A double-blind clinical study is conducted in patients with chronic heart failure treated with ACE inhibitors and a loop diuretic. So there's 2 groups. One receives a beta blocker and the other receives a placebo. And so here's the relative risk results reported for the beta blocker compared to the placebo group. And I'll give you guys a second to kind of look through this table here. And so what we're going to do is look through the answer options individually. So which of the following provides the best interpretation of the results? That did not go through one at a time, but let's look at them anyway. So beta blockers decrease all-cause mortality and cardiovascular mortality. So the first thing they're looking at is all-cause mortality. So we look here and we see the relative risk is decreased, but our confidence interval indicates that it's not significant. It crosses 1, so that can't be correct. Now we have beta blockers predisposed to a CVA. So let's look at CVA. We do have an increased relative risk of CVA, but look again, the confidence interval indicates that it is not significant. The third choice, beta blockers affect all-cause mortality due to decreased risk of MI. We've already determined that the all-cause mortality is not significant, so that choice is not correct. Beta blockers may exacerbate heart failure but decrease cardiovascular mortality. So we look at heart failure exacerbation, and we see that actually heart failure exacerbation is decreased, not increased. The last one, beta blockers protect from MI but do not affect risk of stroke. So let's look at MI. There's definitely a decreased risk. And when we look at the confidence interval, we see that it does not cross 1, so that is significant, statistically significant. So they do protect from MI, but they do not affect the risk of CVA, so we'll look to see if that's true. And here we see our confidence interval indicates it is not a significant finding, so this is in fact the correct choice. All right, here's one more question on confidence intervals. 4 separate studies are undertaken to assess the risk of acute coronary syndrome in postmenopausal women taking hormone replacement therapy. The results of the individual studies as well as the result of a meta-analysis are shown on the table below. Each study result is presented as an odds ratio along with a confidence interval. Which of the following results most likely corresponds to the meta-analysis? So what's the difference between individual studies and a meta-analysis? You'll recall that a meta-analysis pools together data from multiple studies, and so that's your clue to answering this question correctly. If several study sample, and my mouse is acting crazy, sorry, if several study samples were pooled, then your N would be much more increased. And then so what happens as a result? You would see a narrower confidence interval, and so D would actually be the correct choice here. I apologize for the mouse. Okay, let's look at this question. A study explores the role of air pollution in asthma development. 100 children with diagnosed asthma and 200 children without are asked a series of questions regarding the place they live. An air pollution index ranging from 0 to 10 is then calculated and determined to be 5.2, with a confidence interval of 3.1 to 7.2. Which of the following statistical changes would be most likely if more asthmatic children were included in the study? And so we talked about the effect of sample size on the standard error of the mean and the confidence intervals. So if we increase our sample size, what happens to these numbers? So remember that will make our confidence interval and our standard error of the mean decrease. So our confidence interval, the lower limit would increase and the upper limit would decrease, therefore making it more narrow and of course more precise. So of course the mouse is not working. So here's our choices. In the standard error of the mean, remember as we increase our N, that would decrease. So we are looking at these three. We just said that the upper limit would decrease and the lower limit would increase. So this would be the correct answer. All right, incorrect conclusions. Everyone hates errors, I understand. Type 1 error, wrongfully concluding that there is an association between exposure and outcome when in fact there is none. That's the definition. Basically, you rejected the null when in fact it is true. And then a type 2 error is wrongfully concluding there is no association between exposure and outcome when in fact there is one. So type 2 is failure. You failed to reject the null when it is not true. So let's look at this lovely chart. So we have the condition of the null hypothesis. If the null is true, that means there's no association, no significance. If it's false, that means you accept you reject the null and you accept the alternative. And here's your actions at the end of the study. You either fail to reject the null or you reject the null based on your results. So if the null hypothesis is true and you fail to reject it, you accept it, that's a correct decision. That's 1 minus alpha. But if you look below it, if the null hypothesis is true but you reject it, that would be a type 1 error, which we just talked about, which is otherwise known as alpha. Now if you come over to this side of the chart, if the null hypothesis is false, meaning your alternate hypothesis is true, and you reject the null hypothesis, meaning you accept it, that would be a correct decision, and that's your 1 minus beta, and that's my crazy mouse not showing you, that's power, and we'll talk about power in a second. Now, however, if your null hypothesis is false, so your alternate is true, and you fail to reject the null, then that's a type 2 error, which is beta. So this is one way of looking at it. Now, my favorite way of looking at anything is this chart. It's so much easier to me because I'm a math geek. So again, you're looking at your null hypothesis, true or false, and that you're looking at your outcomes, fail to reject or reject, right? And then you can see if you have 2 positives, you have a positive, so that is a true. And then if you have 2 negatives, that's also a positive, so that's true. So you can remember that your correct decisions are here and that your errors are here, obviously. And that's just one way I think about it. All right, so let's take a look at a clinical example of errors. Let's say the null hypothesis is that medication X does not relieve condition Z. Let's say a type 1 error was committed, which means the null hypothesis was true, but you rejected it. So what does that mean? That means medication E does not relieve condition Z, but it's not removed as a treatment option. And so a consequence of this is the patient with condition Z who receives medication X gets no relief. And they may experience worsening conditions, side effects up to and including death, and litigation is possible in this sort of situation. Now let's say you commit a type 2 error, meaning the null hypothesis is false, but it wasn't rejected. So medication X relieves condition Z, but it's removed as a treatment option. And obviously the consequence of this is a viable treatment remains unavailable to patients with condition Z. So development costs are lost and profit potential is eliminated. And that's just a clinical example of errors and how they can affect data. Power is the probability of detecting an association if it exists in reality, which is just basically correctly rejecting the null when it is indeed false. And it depends on the following. So power depends on alpha level, and lowering the alpha level reduces your power. It depends on the amount of difference of an outcome between the study groups. So of course, the subtle difference would be to detect, and that's when we talk about effect size. So a small effect size in a low prevalence disease would be more difficult to detect. Sample size, of course, increasing your sample size increases the probability of detecting a difference, so therefore would increase your power. And like we just talked about, power is 1 minus beta, and typically 80% is the usually accepted power. So I think, oh, here we go. Here's our lovely GIF, showing how the power increases. And I think that's the end of this lecture. So thank you very much for your attention. Please contact me with any questions. I prefer text or email. They're there. And after you complete this video, please go back to New Innovations to obtain the link to the post-lesson quiz. Hi everyone, it's Dr. Custer here. Today we're going to